Discussing fat cavitation, its procedures and protocols, just as a refresher for the training that you've been provided with previously. So today we'll be actually performing a demonstration on a stomach, so fat cavitation. Because the stomach's a larger area of the body, we want to divide it into a smaller area, approximately the size of an A5 piece of paper or the size of your hand. So what we'll need to do is roughly grid out the area to size. Once we've done that, we'll actually put glycerine. Glycerine works best as it doesn't heat up and it actually offers good gliding mechanism too. So just apply a little bit of glycerine, smooth that over, just apply a little bit more so you can't see patches of skin that have got no glycerine on there. And then you're ready to perform your treatment. Before you begin, have a look at your protocols that you would have received during training. On there'll be some guidance as to what settings you start with and how high you go. Depending on the type of machine, you would start at either 3 joules or 5. I'll demonstrate that now for you. When you're ready, turn your machine on. Startup process will only take no more than 2 minutes. Once you're in your main screen, press the down arrow. That'll allow you to choose either cavitation, utilising your 40 kilohertz handpiece, which is this handpiece here, and that's what we'll be using today. Otherwise, you have your 1 meg cavitation, which are your smaller handpieces for smaller parts of the body or for infusing product. Select the appropriate handpiece and then increase your settings right up to 5, which is the maximum output. And that's your watts. Your depth of penetration you want to initially set to 5, depending on your machine. If the maximum your machine goes up to is 8, set it at 5. If the maximum your machine goes up to is 5, set it at 3. Now select your time. So 10 minutes is 600 seconds. And you're ready to begin your treatment. Now, once you're ready to go, you want to apply firm pressure, but not too firm, just enough so you can see the skin actually indenting. And you want to do a practice run, so just nice circles. And when you're ready, let the client know that you're about to start your treatment. Are you ready? Okay, on the count of 3, 1, 2, 3. Depending which part of the body will make the sound vary from area to area. So where I'm working above the rib, the client or the patient will actually hear more of the ultrasonar noise. How does that feel? It's fine. So if the client is able to tolerate that noise, take your foot off the pedal while still rotating and then increase your setting. I'll increase it to 5, which is my maximum. Press play and start again. Are you ready? How's the noise? It's fine. If your patient or client has hearing aids, make sure they're switched off or they've taken them out. If they have metal implants in the area, avoid that area altogether. Obviously, those who are contraindicated would be those with epilepsy, anyone who's pregnant or nursing, you can't treat over varicose veins. Anyone on warfarin or aspirin are okay to treat. However, anyone with a lymphatic immunosuppressive disease or disorder are also contraindicated. If the client's feeling okay, continue this for the remainder of the 10 minutes. Once you've actually finished the treatment area, we can now progress to the other side. Before doing so, just wipe off the area with a baby wipe. If you are going to continue with your skin tightening, radiofrequency skin tightening, you can keep this on and perform that now. If you're going to cavitate the thigh area, all you need to do is divide it into either quarters, thirds or halves, depending on the size of your treatment. But equally, it's the size of your hand or the size of an A5, and you just divide it and you would treat that area for 10 minutes. Once you've done this area, you'd move to the next area, and that area would be 10 minutes. Any part of the body will be treated accordingly in the same way that we do in A5 sizes. Make sure you divide big areas into small areas. With your lymphatic system, it's best to perform lymphatic drainage after a treatment. This helps release all the toxins from the body. Diet and water are also going to play a big role with your treatment outcome. A diet in low fat, low carbohydrates and low sugar will ensure that the body is utilising all those triglycerides that we've just exposed to the body. So exercise will also help eliminate those triglycerides. It'll use it up as energy rather than restoring it as fat stores in the body. So ensure your client does 20 minutes of fat burning exercise as well. This concludes our fat cavitation video. Hopefully it's helped